Hello, everyone, and welcome back to another episode of Zalora Talks with me, your host, Amy Yasmine. I hope everyone's doing super well today, or at least not gone through the major kerfuffle I had to endure a while ago. Now, this is going to sound completely embarrassing and borderline gross, so I'm going to declare a little trigger warning here. In fact, if you're a guy, you might want to skip to the next episode, although personally, I think you might benefit a thing or two here, but we're talking lady stuff here today. Anyways, as I was going about doing my groceries at a mall behind where I live, I noticed a few stares from several people. And then there's me thinking I was attracting a few admirers like the self-indulgent person I am. So I was just going about my way, striding through the aisles, thinking as if it was my runway. But here's the kicker. The moment I got home, and I was completely oblivious by what was happening, by the way, Aunt Flo, my period, had already found her way through my denim shorts, all the way to the back. And I only realized this when I got home. So imagine the horror. The thing is, this isn't the first time something horrific like this has happened to me. In fact, I'm pretty sure I'm not alone here either. There's actually a ton of things about the female body, despite me being in one, have yet to discover and understand. So if you're anything like me, you'd be super thrilled, if not relieved, to know that we have two super women on board with us here today to discuss all things women's health. Hi, ladies, and good morning.
My name is Nazimah Idris. I'm a professor of obstetrics and gynecology. I'm also a consultant obstetrician gynecologist, and I'm a medical director for IMU Healthcare, and I'm an exco with Mercy Malaysia.
Hi, I'm Sulaiman. I am a TV host and food personality and also a food entrepreneur based in Kuala Lumpur, Malaysia. I'm also the co-founder of My PCOS I Love You, based in Kuala Lumpur.
First things first, and I've always wanted to ask a professor this. What are the most common misconceptions about women's health you've ever heard throughout your career, Dr. Nazimah?
I would think, and this happened actually a few months back when a patient told me, we are women. This is our lot in life to suffer from the periods, to suffer from pain, and to suffer from bleeding. Because I asked her, why have you not come to see me before? And she said, no, it's just a women thing. We just have to bear with it. And I told her that it's not normal. But I think she wasn't alone. There are a lot more people who actually took that stand that it is something that happened to us that we have to bear with and not to try to solve it, which is quite sad.
Yeah, and I mean, actually, I just learned about this as well because I'm quite used to heavy bleeding, and then also, period cramps apparently are not a normal thing. A lot of people go through it. What are your thoughts about that?
Okay. If you know the process of us having our periods, the uterus will actually contract because it's trying to help control the bleeding. So some cramps is probably okay. But if it is too much and you need to take time off, you need to take medication, then that is not okay anymore. So there's a line between what is okay, acceptable, what is not. This is what we have to let women know and understand. Pain is not normal. Heavy bleeding is not normal. Not feeling good is not normal. So even if you don't know what that is, but if it does not feel good, does not feel right to you, go see someone and get help. This is what I tell all my patients and for them to tell their families.
Now, just going back to what you said before about, having this discussion with families, but I think particularly in Southeast Asia, there seems to be some sort of an invisible barrier when it comes to, talking about women's health. And it's really a shame, like you said before, why do you think this is so? And, how can we get ourselves to talk more about it amongst each other and break out of that mindset?
I think first and foremost, we as women have to understand our body better. We have to know what is right because we have the responsibility to do the best by ourselves. We have the responsibility to protect ourselves from the bad elements and the right to be in the best state of health, to be happy and productive. So if we understand all that, then we know that when it's disruptive, then it is not right anymore. And in order to get everything to be in order, you probably cannot do that alone. You need your family to support you, you need your friend to support you. So it's a whole system that is going to help women get out of that or break that barrier that you mentioned, Amy. That barrier is actually very real, unfortunately.
I think it's because it's always easier said than done, right? But I don't know, maybe it's because of just our culture, something like that. I mean, I guess, Ili, you're quite familiar with this, you started a platform for PCOS specifically, My PCOS, I Love You. And, congratulations to you for doing that.
Thank you.
So really big kudos. But how do you, even take the reins and break out of that mold? Because it has to stem from somewhere.
Yeah. And I think I have to, applaud my mother, who always made it okay for me to speak to her openly about my sexual health, especially with periods, cramps, discharge, pain in the breast, and things like that at a very young age. So the minute I hit puberty, even before I hit puberty, like mom was always very open, and even my dad. So my father is the only person I know who's a man who is not ashamed to go to the pharmacy and buy pads and panty liners and women products. So I think because he grew up with women as well, and he was kind of like the only boy always at home. And so, so I think that conversation needs to happen, not just with family members, but also with girlfriends. Because, growing up, it was not just me who, had the open conversation with my mother, but my girlfriends also felt comfortable talking to her. And I see the impact that it has had on us growing up, and hence why it was very comfortable for me as a personality to speak openly as well about my struggle with my health, in particularly with PCOS. And I also have endometriosis and a thyroid deficiency. So I have 3 things that I am currently working to overcome. And it's a struggle. And I think that if I'm going through this, there's a lot of women out there who are possibly also facing the same challenges.
Tell us more about, My PCOS, I Love You, actually, because this is something that's quite interesting, especially within our Malaysian community, I think.
Yeah. So when I started talking about it openly, there was a friend of a friend who got in touch, Dina, and then another friend of a friend got in touch, which is Dr. Stephanie, and the 3 of us kind of got together and was like, we don't know each other. The only thing that brings us together is our condition. So I'm sure there's a lot of other women out there who are struggling to do this, to talk about it even. So we decided to create a platform and a community that supports women who are going through PCOS or any other women's health issues, but more focused on polycystic ovarian syndrome. Then also we are also an ecosystem that supports them through reliable sources that have been vetted through, because one of our co-founders, Dr. Stephanie, is a doctor. We have nutritionists that we work with. We have personal trainers that we work with, other doctors, gynecologists, even natural practitioners like acupuncture and things like that. A study has been done a long time ago. It was in the 90s, but PCOS affects 1 in every 10 women. I'm sure the numbers are a lot more now, but there hasn't been a recent study on this. So the platform is really great just to bring people together, even if you're a man, you're a husband, you're a brother, you're a friend, and you want to know more about polycystic ovarian syndrome because maybe your sister or your mother or your best friend is struggling from it. We are the place to go to find out more about this.
Just give you a bit of background. What is PCOS? It stands for Polycystic Ovarian Syndrome. So it is actually a syndrome with a few clinical features in there. Commonly, you have menstruation problem. Either your menstruation or periods are too little or did not come at all, or we call it oligomenoric or amenorrheic. The second is the hyperandrogenism, where you have a higher level of androgens, which is a male hormones in your body, and it cause a few changes. And the most distressing one, especially for the younger people, is the facial appearance, where there'll be more hairs, more acne on the face, and they'll be very worried about the image. And third is when we look at the ovaries, it has this polycystic appearance where there are small follicles in the ovary. The follicles are actually, the function is for it to grow, become bigger and ovulate, so we get the eggs for our reproduction. But in polycystic ovarian syndrome, because of the hormonal issue, the follicle remains a small size, between 2 to 9 millimeters. So when we do a scan, we could see that. So if we see a patient who comes with whatever they come to us with, and we notice that there is some hyperandrogenic appearance on the face, and they have their periods problem, and when we scan, we see the ovaries in that appearance, then we diagnose polycystic ovarian syndrome. So this is how the diagnosis comes from. I suppose it depends on how alert your doctors are to the underlying problems. If they're not thinking of it, then you'll miss it. I'll normally get young people who has menstruation problem. Period problems are the one that brought a lot of young ladies to the doctors, and this is where we get the diagnosis from. Or some of them would just have the body image issue and they want to know why. And another group is the one who's trying to get pregnant, and there's some difficulty getting pregnant from the issue with ovulation that I mentioned to you.
Actually, I stumbled upon another stat that said 75% of polycystic ovarian syndrome cases are believed to be undiagnosed.
Yeah. And I think it's also important to note that a lot of within the community, because we did a recent survey, and I think about maybe 40% of the people who have been diagnosed with PCOS, like you said, Amy, were not diagnosed for a really long time. They didn't have the cysts or the follicles on their ovaries when they did the scan. So it was more like there is a different spectrum. So you have spectrums of PCOS, which is really flat, very, very chronic, where there's facial hair, weight gain, irregular periods. When I say irregular periods, it's their cycles are 90 days to 60 days kind of thing. And then it's also insulin resistance. So their insulin is really high, thyroid deficiency, vitamin D deficiency. So what Dr. Nazimah says is that basically it's really the doctor that really clicks on, because not every woman's PCOS is the same. And that's something that we are constantly reminded every day when we speak to the women in our community, that what I have is very different from what Dina has, my co-founder, or what Stephanie has. And there's also a myth about women with PCOS who can't get pregnant. And, so there's also that insecurity, anxiety, and depression that kicks in as well, because as a Asian community, as women, I'm sorry to say this, but it's the norm for women to be reproductive,
It is not just about the problem that you're having currently, but also your future health issues, because PCOS actually leads to cardiovascular problem, diabetes, cardiovascular problems. So that is why we want to diagnose it, we want to treat it, we want to prevent your long-term health issues.
Yeah. And it also leads to cancer, right? If it's not, so ovarian cancer, breast cancer. So actually it's a lot of the really chronic diseases like diabetes, heart failure, heart problems, and then cancer. These are the three things that are a no-go for women. So yeah, scary stuff, but really important to be talking about it.
Yeah, absolutely.
Yeah, but it's just getting more common. And the thing is PCOS is actually a genetic condition. The likelihood of you getting it, it can stay dormant. So in some cases, even if you hit adolescence, you're fine. Your period is still regular. Your weight is fine. You don't have hair growth. And then something happens in your trajectory that triggers it, and then it flares. And when I say it flares, it means your period stops. You have hormone imbalances. You start gaining weight. You start have facial growth. You start having anxiety, and basically that goes out of whack. So, but you can treat it, and you can manage it through lifestyle changes to kind of reduce the symptoms. But it's a genetic condition. So I just want to say to women out there, it's not your fault if you think that you brought this onto you because you didn't look after yourself,
I would say there is a genetic predisposition to a lot of conditions. But it does not really mean that you're going to pass it down. It's just, it is just you that have it. But you do. It is not genetic in the sense that then the whole line of your family will have it. No, because it is a lot of things are multifactorial. There are a lot of factors that can cause you to get that. But it's very important what Ili has mentioned, that it is not your fault. I always tell my patient it's not your fault. It happens. But of course, you have to get treatment, you have to get better. Just taking it and not doing anything about it because that's what happened to women is not acceptable for me.
Ili, you're a celebrity chef.
Yeah.
And then how do you kind of like blur the, your worlds together? And I see you like posting all these PCOS recipes, which, I try to do myself as well.
Yeah.
And, there's a specific gap that you're kind of like filling in. And I mean, as you both have mentioned, it's all about the lifestyle. Now, how do you convey that to everyone else, Ili?
I mean, it's tough because we're Malaysians and we love our food, you know what I mean? So it's really hard to find the balance. And someone like me who works with brands, who is a personality, and sometimes like I work with clients who want me to cook a specific type of food, or whatever it is, it's really hard to say, okay, no, I can't, or I can't be endorsing this, and so on and so forth. And I think everybody struggles with that in their lives. But I just try to tell myself, do the best that I can today. And I just take each day as it comes. And the thing with PCOS is a lot of people don't realize is it affects your mood, right? Because you're talking about insulin, you're talking about thyroid deficiency, you're talking about vitamin D deficiency. There's a lot of deficiencies in your body because everything is haywire. It's a very chemically compounded disease, I would say. So sometimes I wake up and I have bundles of energy and I'm able to do my exercise and my dancing TikToks, and then I'm able to cook breakfast, lunch, and dinner like no problem. But then very next day, I could wake up and just feel like, I don't want to see anyone. I don't want to talk to anyone. I just want to be in my hole, and I cannot be my bubbly, loving self. And I have to acknowledge that my body is not okay that day, and I just rest. And that's the thing with PCOS, right? It's finding balance. So it's like, even with food and cooking, I try to encourage people to cook at home. Because I think that's the number one thing is if you cook at home, you know what goes into your food. You know the produce that goes into your food. And I also focus very much on localized food. So like ulam and like, rice. I don't cut out rice.
Yeah, I think it's very hard for like any of us.
Yeah, because rice is actually a very anti-inflammatory food, rice grains, especially basmati rice, is very good for you. It's just knowing how to cook it. Obviously, like don't cook it with ghee and, like put curry on it, that kind of stuff. I use a lot of turmeric in my cooking. I eat kampong eggs. I have salted fish, these like really traditional Chinese soups and Malay cooking that use fresh coconut milk. These are all so good for you. So what I'm doing is I'm going back to basics. Like I think about like what my nene and my tok used to eat, what my pawpaw used to eat, and I just like try and re-educate people that, okay, you can have this every day. And then once in a while, you can makan lah roti canai and, it's okay, So I try and be good 80% of the time, and 20% of the time I indulge, because if I don't indulge, then I'm miserable and then I fall back into depression and I'm sad and there's no point. But it's just to do the best that you can. That's all I say to the people that I talk to.
I guess you can call it food for thought.
Yeah, food for thought. Oh my God.
What are your recommendations? Because of course, there's always like a correlation between, diet and, the moods that you have.
What Idris said was extremely important, because it is not just the medication. Doctors tend to think about what medication to give you. But other than that, your lifestyle, what you eat, the exercise that you do is also extremely important. So I would normally refer to another professionals, the dietitian, nutritionist, to help them with the diet, the therapist, if they have issue if they think they need to speak to someone about their psychological health, then I would refer them to a psychologist. And also I would encourage them to have a personal trainer or coach that can help them personalize their exercise. So it is all about personalization of the treatment to what you need, because like what Ili has mentioned, not everyone needs the same thing. Not everyone needs to lose weight, but of course everyone needs good food and a good lifestyle.
This is like music to my ears, meeting Dr. Nazimah. Yeah. Sorry, I just have to say, it's just wonderful to meet a doctor that doesn't just jump straight to medication, because I feel like so many women out there, when they see the gynecologist, they are straight away put on very strong medication, and it really does defer the problem. It doesn't fix the problem.
Now, I just wanted to ask, doctor, a very quick question. What is your diet like?
Okay, good question, and good that you asked about it now and not like some years ago. I had a health scare actually. I have always been small. I suppose that's genetic also. But about last year, I have put on some weight. The clothes are getting tighter. I made a joke about, okay, I need new clothes, it'll be nice. But when I checked my blood pressure, it was high. And it was really scary. And my husband was scared also. He said, not like you to have high blood pressure because you're always so fit. But it was borderline high. So I said, that's it. I'm going to improve on how I live my life. So first on diet, for breakfast, I had light breakfast, very light lunch, and normal dinner, I suppose. And I had supper actually, because it's my private time with my husband, to have him having coffee and me having something good for the mental health also, I suppose. So for breakfast, I mostly take the chia seed that I soak overnight in almond milk. Then lunch, I have a piece of whole grain bread. That's it, with a slice of cheese, because I need calcium for my bone. Dinner, I have normal dinner, a scoop of rice, and try to use a low GI rice. The normal Malay lauk, okay, and that's it. Yeah. It's not too difficult, and managed to lose a bit of weight, and my blood pressure went down back to normal. So I'm quite happy with that. Cut sugar altogether. I think the biggest culprit in the diet is the white sugar. So I cut sugar altogether. I did not even have cheat days, except if my daughters cook. So if my daughters cook, then okay, I'll take some.
I've got like literally so many questions right now. But okay, I also came across another study that high blood sugar has a bigger health impact on women.
Definitely true. It's a precursor to all other problems or most other problems. Because when you have diabetes, when your blood sugar is so high, one of the effects is it damages your blood vessel, your small vessel, it's called microvascular disease. And when your small blood vessels in all your organs are damaged, hypertension will set in, heart problem will set in, and it will just go downhill from there. So it's extremely important to understand that sugar is poison. Sorry to say that, unless you can take in very small quantity, like they say 25 grams a day for average people. But if you're trying to lose weight, if you have medical health issues or health issue, you have to take very little of it, because it is everywhere actually, and not just the white sugar that you see.
Now, going back to something that, the both of you have touched on, especially you, Ili, how doctors or like, I guess patients always get like, it's always medicine first. Now, I understand, or I have kind of observed how, everyone, if you have like a period problem or if you have like period cramps, those kind of things, the pill is always like the go-to solution, but it isn't. It's really just like a band-aid, isn't it?
Yeah. It doesn't help anyone. Yeah. And there's a term called hormone recovery for PCOS. So women who have been prescribed the pill to regulate their periods, and they've been on it for years and years, and then their body needs to reset and like kind of really think about how to ovulate properly again, how to have like the uterus like contract, and it's like it takes a long time for the body to readjust to that. And we have a lot of women in our community who have polycystic ovarian syndrome and were given the hormone pill to regulate their periods, and then now are struggling to reset their bodies because they are now preparing their bodies to get pregnant and to be fertile. So it's really sad that a lot of doctors prescribe that as a number one PCOS medication, and then they say, "Oh, come back to me when you're ready, when you dah nak kahwin, when you want to get married and you want to start having kids." And that really irks me because not every doctor is like Dr. Nazimah, you know what I mean? Who really speaks to the patient, tries to understand different ways of like fixing the problem, right? I was prescribed metformin because my insulin was quite high, but I didn't react very well to it. I had metal tongue, dizziness, migraines, and it was affecting my work. So I've completely gone off it, and now I take Ovasitol, which is a natural supplement, which really does help me, and I don't have any of those symptoms anymore. And like I said, I take a lot of supplements to regulate it, and I can honestly say that my PCOS is kind of on the verge of maybe being managed because I've lost weight, my periods are regular, I don't have that anxiety and stress anymore, or I haven't fallen into depression in a long time. I can see changes in my skin. I can changes in my hair. Like I used to have like botak, all here, but my hair is starting to grow back, and I feel like my 20-year-old self. And I think that that's important to note, that it's not just like one medication that can fix it. It's like really like it's taken me about 2 years now to just really like understand my body, listen to it, respond positively to it. Yeah. But with help of a doctor, of course. My doctor is amazing. Yeah. So always consult with a doctor. That's what I have to say. Like, just don't listen to me. Like, you can like look at me like an older sister kind of situation, like, find inspiration, but always consult with a doctor. And if a doctor makes you feel uncomfortable, a doctor doesn't look at your situation as serious, then find another doctor. That's why I always say to all the girls that message me.
The key factor is actually your motivation. That is key. No doctor can help with that. It has to come from our own. The goal has to be clear, and how to get there has to be clear. This is what I try to provide for my patient. Like, let's see what you want actually, and how motivated are you. If you're not motivated, the drug is not going to help you very much. You have to work on the other aspect as well that only you can do. So I'm very happy to hear what Ili has mentioned, and I wish all my patients are like you. We would achieve so much better result with this.
Doctor, you can just tell your patients, go to my PCOS, I love you, or just they can DM me straight on Instagram. I'll be happy to be a big sister to them, no problem.
Do you think we have a certain sense of period poverty in Southeast Asia?
I would say the simple answer to that is yes, because it is a topic that was not openly discussed, because it is considered something embarrassing that should be kept private. I think because traditionally it is looked at it that way, that women shouldn't be hurt and you should take whatever comes, including the issues with your period. So again, it goes back to educating people, us women, as well as our family members, the men especially, because somehow, besides listening to their girlfriends, women, they also listen to what men say. So if it did not come out as supportive, it is actually very distressing. So if we can educate both men and women to accept that it's a normal process in a woman's life, there may be problems and you have to understand and be supportive. The key to it is education and empowerment. And for us to realize that we are highly worthy individuals. We are not just an extension of a husband or a father. We are independent and we have the right to feel comfortable about ourselves.
Okay, so now our generation of women, my peers are now having their own children, and I feel like it's time that, because we know what the situation is like, so we have a voice to change this generation of kids. So maybe our parents might not feel comfortable talking about periods and women health and things like that, but we are the voice of reason. So now that we have our own children, we can have that open conversation with our kids. So that's when the change happens. It's like we cannot change the older folks. It's okay, we can change the future. So that's just another thing I wanted to add on from what Doctor said.
You have to treat your sons and daughters the same way. An example, the HPV vaccine, the one for prevention of cervical cancer. So my daughters get it. I give it to my sons also. And they were making a joke about, Isaac, how's your cervix now? Because I said, I'm doing this for my future daughters-in-law. Because if my sons are vaccinated, they will not carry the virus. They will not infect the girls or their future wives. So that's how I see things. So I treat them the same, that you have to take care of the girls also.
Yeah, good on you, Doctor. Good on you.
I didn't know that boys could take it.
Yeah, me neither. I didn't think boys could take it either. I'm like, huh?
In the UK, they're vaccinated. They are both boys and girls. So you vaccinate the girls, so they don't get the cervical cancer. You vaccinate the boys, so they don't get the other conditions that is associated with the HPV virus. At the same time, you don't have the virus, they will not transmit it to their sexual partner, because girls get it from the sexual partners.
Learning new things. See, told you.
Mind blown.
This is amazing. Yeah, it's like so
okay.
good.
If there's like maybe one thing or two that you hope that other brands or other individuals who are listening in on this, what can they do to kind of further amplify women's health or the awareness of women's health today?
First, give them information, correct information, important information. Second, all these brands, they can fight misinformation. We found that from our side now, because of the social media, because anyone can just write anything on the social media, there are a lot of misinformation and we're spending a lot of time fighting it. So if you're a very well-known brand, if you're a known personality like Ili, if you can give correct information, fight misinformation, a lot of work has been done already because people listen to you. Doctors are normally quite... in their rooms and not so much exposed to the public and don't have followers like Ili has and things like that. So we can talk to people who come to see us, but we will not be able to reach as many people as those personalities or the brand that is well established. So that's where we can work together to get to where we want to be, for the women to be educated and empowered to look after themselves and the people around them.
I feel that what Doctor said is right. I am a personality. I have a responsibility to speak the truth as best as I can with evidence. So I try and create positivity. I try and create a sense of you can do this kind of attitude. I'm not perfect. And when I'm not perfect, I'm honest about it. And I also think that consciously when I work with brands now, I am very picky about the brands that I work with. I have to strike the balance of working with brands that echo what I am striving for, but also balance it out with brands that are very home built or brands that are very nostalgic and things that I grew up with. And like I said, I'm 80% good most of the time, where I'm really strict about my nutrition and my lifestyle, but 20% of the time I indulge, because what's life if you can't enjoy it, right? So it's about balance and what makes me happy, and I think that's the most important thing.
Now, just to give it a bit of a fun twist here, just before we end, I want to do a really super quick fire round. So they're just going to be, this or that kind of question. So you guys choose, yeah? Okay, number 1. Would you rather have period cramps or adult acne for the rest of your life?
Cramps.
Cramps.
Okay, number 2. Would you rather do intermittent fasting or cardio?
Intermittent fasting.
Too lazy for workout.
Okay, would you wear pads or tampons?
Period cups.
Good answer. This is a bit of a tricky one, but I can't answer this. Eat something bland but healthy for the rest of your life, or unhealthy but yummy for the rest of your life?
Bland lah.
Really?
Yeah. Because then I can enjoy life.
True. Long term. Okay, we're in for the long game. And the last question. What advice would you give your younger self?
Do what you feel is right.
Illy? You thought she was going to be going on for a little while, so you had time to think, didn't you?
Yeah. That's a really loaded question. Suddenly I feel really emotional.
It's okay, let it all out.
I think I would say, I don't have any regrets actually, but I would say one thing is that don't take it personally.
You guys are like team one-liners today.
Yeah.
All just one-liners. I guess we'll have to wrap this up on that high note. But, thank you so much, Illy and Professor Nazimah for joining us today at Zalora Talks. Such a great pleasure for having you both and really such refreshing and informative discussion between two very open people. Now, to everyone listening in at home, I hope this conversation can steer you to make some well-informed decisions. And if you ever need more of that, maybe book an appointment with Dr. Nazimah. She's at IMU. I'm just saying. Otherwise, if you're suffering from PCOS, please note that you are not alone, as Illy had mentioned. Especially not when you have the warmest and most inspiring people to surround yourself with.
If anyone out there wants to know more, you can just DM me privately, Illy Sulaiman, or you can head to the website, www.mypcosilloveyou.com.
Thank you so much, ladies. And I'll chat soon on the next episode of Zalora Talks.
Bye.
Bye-bye.
Bye.